Thank you for entrusting Good Samaritan University Hospital with your care. Our goal is to ensure your experience and stay with us is positive, providing you with the information you need to recover quicker and transition to your home setting easier. Your healthcare team is comprised of a multidisciplinary team, including your physician, nurse, care coordinator, and more. If you have any questions, please feel free to reach out to any of the team members. Good Samaritan has some of the best outcomes in spine surgery infection rates when compared to facilities across New York State and the U.S. Our readmission rate is also less than the national average, with 92.5% of patients seeing an improvement of their symptoms within weeks of their surgery. Realistic expectations are for you to experience a decreased level of pain, restore your function, and increase your activity level. Your first visit prior to surgery will be to Good Samaritan's pre-surgical testing, located at 15 Park Avenue in Bayshore. During your visit, a medical history physical assessment,
Okay, so you're going to follow me. 2 quick pictures of your chest.
COVID testing, and a nasal swab will be performed. Blood tests and an EKG will be performed if required by your physician. While getting ready for surgery, please follow these on-screen tips. You will shower with the antibacterial soap given to you at PST the evening before your surgery and again on the morning of surgery. Do not use the antibacterial soap on your face or groin area. Do not shave the area of the surgery. Do not apply powder or lotion after your shower. Remove nail polish. Stop using all nicotine products and illicit drugs. You may need pre-treatment with antibiotics prior to subsequent dental procedures for a period of time at the direction of your spine surgeon due to the risk of hardware becoming infected from bacteria that could enter the bloodstream. Preparing your home. Prepare several meals ahead of time and store them in your freezer. Remove throw rugs whenever possible to avoid tripping. Avoid waxing wood or linoleum floors to prevent slipping. Move electrical cords and other tripping hazards out of the way. Make sure handrails are well anchored on stairs. Non-skid treads can be placed on wooden stairs. Make sure carpeting on stairs is secure. Arrange furniture so that pathways are not cluttered. Chairs and tables need to be sturdy and stable enough to support a person leaning on them. Arrange to have someone come to your home to perform any cleaning work that may need to be done. Consider finding an area to keep any pets that may jump up on you or get in the way of your walking when you first get home. Planning for your hospital stay. Bring loose, comfortable clothing that fits in a small overnight bag. Wear sneakers or other supportive footwear with good traction for walking. Avoid slippers, sandals, and backless shoes. Bring a copy of your advance directive and medication list. Bring your back or neck brace if obtained prior to date of surgery. If you use eyeglasses, dentures, hearing aids, be sure to bring them with you. Bring your cell phone and charger. Do not bring large amounts of cash, jewelry, or home medications. The evening before your scheduled date, you will receive a phone call informing you of your arrival time and where to enter the hospital. These phone calls are generally made between 6 p.m. and 10 p.m. If you need assistance, please ask for a wheelchair and someone will assist you to the ambulatory surgery unit. Good Samaritan University Hospital is shaping the future of healthcare. As of now, you have seen the construction on campus related to the development of our patient care pavilion. Good Samaritan expects completion of the patient care pavilion in early 2025. This new enhancement will be located on the northeastern portion of the campus and will provide the community with a new 70,000 square foot emergency department, 16 new high-tech operating rooms, and initially 36 private patient care rooms with an additional 72 when fully complete. The Patient Care Pavilion was designed to provide the highest level of health care for years to come, while also helping to recruit the nation's top physicians to the South Shore of Long Island. Due to this progress, there are some changes around campus. This video will assist you in locating the correct areas for your visit. Please enter the hospital through the Baxter main entrance. While there, you will be greeted by our concierge.
Good morning.
If you need assistance in reaching your next destination, a member of the concierge or transport team will provide a wheelchair and transport you. Your next stop will be the Ambulatory Surgery Unit, ASU, North. A member of our team will escort you to this location.
Hi, here for surgery today?
Yes, I am.
After checking in with the desk in the ASU North, you will be met by one of our clinicians to ask you specific questions related to your procedure and provide you with an ID band.
Okay.
In addition, you will be asked your name and date of birth a number of times during your visit. They will provide you a gown to change into and a bag for your personal items. A nurse will start your IV and review your medical history. They will ensure that you have completed your antibacterial bathing to prevent infection. Once ready, you will be transported to the hospital's 5th floor, where you will again verify your name, date of birth, and procedure. You will meet your surgeon and anesthesiologist. Some surgeons prefer to have a plastic surgeon involved in your wound closure. You will meet this physician prior to your surgery. The surgical procedure will be explained to you, your questions will be answered, and informed consents will be obtained. Your spine surgeon will mark your skin at the site you will be operated on. Your surgeon will discuss with you the length of time that you will be expected to stay in the hospital, which will be based on your overall status post-surgery. Depending on the type of surgery that you have, you can expect to be in the hospital up to a few days. While you are meeting the team, the OR staff is preparing the surgical suite for your procedure. Once ready to proceed, you will be taken to the operating room. Your surgical team consists of surgical nurses, an anesthesiologist, surgeons, and surgical technicians. A timeout will occur where all clinicians in the room verify your name, date of birth, and surgical procedure and site. You will participate in this prior to receiving anesthesia. The nurse will place monitoring devices on you that will monitor your blood pressure, heart rate, and oxygenation. Special stockings will be placed to prevent blood clots in your legs. Antibiotics will be administered in the OR prior to the surgery. You will also be on antibiotics after the surgery for a period of time, depending on your surgeon's preference. After your procedure, you will recover in the hospital Post-anesthesia care unit, or PACU. You will be closely monitored by nurses in this area. You will wake up with supplemental oxygen, continuous intravenous IV infusion, and special pneumatic stockings on your calves. You may have one or more surgical drains. The team will perform a neurological exam during this time. It is important to tell your nurse if you feel numbness, tingling, or pain anywhere. Communicate your pain level as best as possible. The staff will do everything they can to keep you comfortable. The surgeon will contact your designated family or support person to discuss your surgery. Make sure you give us a phone number where we can reach them. Until your medical status is stabilized, you will remain in the PACU. This time will depend upon your response to the anesthetic and pain control. Stays in the PACU that seem longer than expected do not indicate a problem. Visitors are not permitted in the PACU to protect the privacy of all patients. Once recovered, you will be transported to one of 3 locations: 3 South to a medical surgical patient room or SICU, or the neuro ICU if closer monitoring is required.
Hi,
Hi, my name is Robin. I'm the nurse manager. I just need your name and date of birth.
On all of these units, you will continue to be monitored
Hi, how are you?
for vital signs, pain level, surgical site status, and cardiac rhythm. You will be asked to review your medical history, allergies, home medications, and preferred pharmacy. Following these instructions will help lead you to a quicker and better recovery. You will be taught to use an incentive spirometer to expand your lungs. You may have an indwelling urinary catheter. This will be removed the next morning.
Push up from the chair.
You will be getting out of bed that day or the next
Now you're
morning.
gonna push this like a shopping cart and we're going to take a little walk.
Physical therapy may be requested by your physician. Studies have shown this is an important element of your recovery. Upon receiving a physician order and medical clearance, if you need it, physical therapy will evaluate you by the day after your surgery. Your participation is vital for your recovery. Take pain medication prior to physical therapy as needed. You will be instructed in exercises that will help you improve the motion and strength in your legs. You may have to wear a brace after surgery. You will be educated on how to put it on. Make sure that you wear the brace as directed. Your surgeon may have placed one or more surgical drains in the surgical site to decrease complications of delayed wound healing and infection. These drains may remain in place for several days. The nursing staff will monitor the characteristics and amount of drainage. You may be discharged with the drains in place and will be educated on the care of the drains prior to discharge. To help decrease your risk of falls while in the hospital, use the call bell when you need assistance. For your safety, do not get up on your own until you are given permission to do so by your doctor, nurse, or physical therapist. Stay out of bed as much as possible. Wear slipper socks with grips, shoes or sneakers with non-skid soles. When using the bathroom, use the call bell near the toilet to call for assistance if needed. Use your glasses, hearing aid, or other assistive devices. Ask the staff, family members to make sure the items you need are within your reach.
Hi dear, how are you doing with pain? How are you feeling?
Managing your pain after surgery helps to speed your recovery time by allowing you to move, which lowers the risk of complications. We will make every effort to manage your pain level, but after surgery, there will be some discomfort. We aim to get you to a level where it does not inhibit your movement and ability to participate in physical therapy. At any time during your initial recovery, please notify the nurse, therapist, or doctor if you are not receiving enough pain relief.
Good morning.
Oh, good morning.
Your diet will be advanced as you are able to tolerate it. Remember, calorie and protein needs are greater after your surgical procedure. Glucose control is essential, particularly if you have diabetes. Aim for 3 meals a day and snacks as tolerated. Eat all meals out of bed in your chair. Place pillows in an A shape behind your back when seated in a chair. Constipation is common after surgery due to anesthesia, inactivity, and opioid pain medications. Early ambulation is key. Increase fiber from fruits, vegetables, and whole grains, and drink plenty of fluids. Hot liquids such as coffee or tea and drinking prune juice can help ease constipation. Drink 8 glasses of water per day. If there is no bowel movement within 3 days of surgery, speak to your nurse or doctor. You may need a laxative, suppository, or enema. Take stool softeners at home to stay ahead of constipation. After surgery, you have a higher chance of developing a blood clot in your legs. Symptoms include an unexplained pain in the leg, often the calf, swelling and redness in one or both legs. Your doctor may prescribe blood thinners to prevent clots from forming. Side effects of this class of medication include bleeding, which is a concern following surgery. Blood clots are most likely to form in the first 4 weeks after surgery. Sequential compression stockings may be ordered to prevent blood from pooling. These should be worn when in bed or in the chair. Getting out of bed and walking is the best prevention, but this must be done safely. Do not get up on your own until you are given permission to do so by your doctor, nurse, or physical therapist.
That they'll do everything they can to see you through this and help you to feel better and get you home and active again.
Thank you very much.
Good Samaritan University Hospital recognizes that during your stay you may experience moments of strain and worry.
Is there any tradition that you follow?
We provide care in a manner that is respectful of your own individual religious tradition and is also inclusive of those who hold no formal religious affiliation. Chaplains offer spiritual support that can assist in coping with and recovering from physical distress.
Hi, Linda. My name is Maria. I'm from Managed Care Coordination.
Good morning.
After surgery, a manager of care coordination will review your medical record for past medical history, review all evaluations completed, speak with the surgeon, and note any special needs. The vast majority of our patients go home following spine surgery. In the rare occasion that you cannot be discharged home, the care coordinator will meet with you and/or your designated caregiver to discuss any skilled needs and communicate the care you require at that time. You will be involved with all decisions concerning your discharge plan. Social work and the managers of care coordination are available for emotional support and can offer assistance or referrals as needed. By day of discharge, you should be able to get in and out of bed, transfer and walk with an assistive device, safely maneuver in the bathroom, go up and down stairs safely, communicate and understand post-operative instructions. The length of your hospital stay will depend on your medical needs following surgery. Incision care. Shower only after cleared by surgeon. Use a shower stool or chair if needed for balance. Dry the surgical site gently and completely. Pat, do not scrub. Don't peel steri-strips or dermabond from the incision. These will dissolve or fall off on their own. Do not wear tight-fitting clothes over the incision. Do not apply creams or lotions to the incision site. Avoid soaking the incision in water until cleared by your surgeon. Contact the physician if you see redness, swelling, or drainage, or if you have a temperature greater than 101 degrees Fahrenheit. If you are discharged to home after surgery and require home care services, a nurse and physical therapist will visit following discharge from the hospital. Physical therapy may visit up to 5 to 7 days the first week based on physician orders and clinical need. Your home care team will help you recuperate safely, check your incision, review your medications, help with pain management, and individualize your exercise program. They will teach you how to safely move around your house and update your doctor on your progress. Thank you for choosing Good Samaritan University Hospital. We appreciate your confidence in us and wish you a speedy recovery.